Welcome to my channel, Conversations with Dr. Sue. I am Dr. Susan Musicanth, counseling psychologist and author. And today we are going to be exploring the area of ADHD, Attention Deficit Hyperactivity Disorder. We are going to be joined by Carel Ziervogel, psychiatrist, who through the many years of my practice, I have referred adults to him for attention deficit disorder. So he is going to add in the psychiatric medical approach to this commonly experienced disorder. What I would like very much to know is, how did you get to have experience with attention deficit disorder in adults?
It was interesting because I was seeing children and adolescents with ADD and ADHD, and we'll use those terms interchangeably because often it becomes blurred what the difference is. And some of that will maybe become clearer as we talk further. But as I was, and as part of, as a child and adolescent psychiatry, one always sees the family as well at some point or other, and usually as part of the assessment. And what struck me quite forcibly was that there's a strong family history of ADD.
Interesting.
And when I was interviewing the child, it fairly soon became clear that one or other of the parents had ADD or had it in the past, and very often still was experiencing quite a lot of the symptoms of ADD. For instance,
undiagnosed. Okay.
And when I asked about it, nobody had ever brought it up with them or mentioned it.
Yes.
The important parts of ADD and ADHD, of course, is that it's a disorder.
Right.
And we'll call it a disorder, but we can also look at it in a different light, in a way, that nobody had brought it up with them when they were children or when they were at school, or if they had, they'd been either labelled as naughty, but very often underachieved.
Yes.
And then also some of them had been put on treatment, which was Ritalin, but when they were children, the only form of Ritalin available was the short-acting Ritalin.
The 4-hour
pill, yes. So quite often they had found that fairly unsatisfactory. So it was that I started becoming interested and feeling, if we're going to help this child and this family, it's important to help the mum or the dad.
And mostly the mum or the dad, or not really a difference?
No, in my clinical impression, and as you know, it's difficult to extrapolate in terms of epidemiology just from such a small sample, was that pretty much equal prevalence in women and in men. And that's one of the very satisfying things about treating adults with ADHD, is they respond well to medication. Look, quite often it's a trial and error process in discovering which form of medication is most suitable. But the second reason why it's satisfying is one of the important parts of the treatment is not just the medication, but it's really a case of coaching in terms of executive functioning. So planning ability, time management, placement of things, learning to cope with that, and then getting insight into their own symptoms and how it affected them.
Besides, when you interviewed parents of children who were struggling with ADHD or ADD, what were the signs, symptoms? Was it disorganization, not fully achieving their potential, just feeling less than?
Absolutely, feeling less than and quite dissatisfied, because it's a continuous struggle for these folk. They're struggling, and for the spouses as well, and usually it ended up by getting some collateral information from the spouse.
Right.
who would, as you inquired after the symptoms, would say, yes, of course.
Now they realize.
Now I see you. That is so true. Procrastination,
yes.
Not being able to complete tasks, forgetting things, forgetting appointments, forgetting where your keys are, forgetting where they left things, that cell phones, forgetting them and losing them.
And then did you find that some of the people that you saw, adults or adolescents or children, when they were interested in something or an area, that they got super focused or over focused, and that's not necessarily for good?
No, that is extremely common, what we call hyperfocus.
Hyperfocused,
So once they've got involved in something that interests them,
there's no going back.
Boy, you can't get them off that activity. And so, it becomes very disruptive for their lives because, you've got a task to do which requires mental switching.
Sure.
So you've got to pursue the task to a certain point, and then you've got to say, okay, I've done that, now let's go to the next part of it.
Almost
or let's go
multitasking.
Absolutely.
Okay.
Or go to another task altogether, which may or may not be related, but which requires attention at that point, and they can't let go of what they're on, that hyperfocus.
So is this also connected to, I suppose now, social media?
Yes.
With the screens and the
definitely.
Kids and the adults.
And the adults, yes.
When you get super focused
Absolutely.
on an area, and then with the algorithms, whatever, it takes you off into another area.
Yes.
And difficult to come back and...
Absolutely. So then they get stuck there for hours.
Too long.
Possibly,
Yes.
for a long time.
Yes.
And other tasks are not attended to. So
But
that is quite disruptive.
Okay. Is the super focus also for good? Like if somebody's deciding to study something of interest?
Yes.
For myself, I had children, I was married, I needed to provide dinners.
Yes.
So I had to tear myself away from studies to see to my family. And I think that was a good thing. Otherwise, I would have stayed.
Absolutely, yes. But you were able to. So if you did have those symptoms, you'd manage to develop those executive functions, which a lot of adults do manage. And I guess you have to manage that in order to continue functioning in the workplace, in the family, in all those things we have to do.
And what have you recommended? There would be medication, like, for example,
there are two main types of medication. Stimulant medication, which is usually the first line of treatment.
Is that like Ritalin?
That's Ritalin, which is methylphenidate, and I can come back to the differences between them. And now we also have, in the United States, amphetamine, and now in South Africa we have what's called lisdexamphetamine or Vyvanse.
I've heard of Vyvanse.
Yes. So that's one of the amphetamines, but it's not the addictive amphetamine. So that's one of the reasons it's never been approved in South Africa until the last couple of years. Until very recently, because the Medicine Control Council was worried about addiction. But with the longer acting ones, there's very little problem with addiction.
So there's been the different types of medication.
Of the stimulant medication. And then there's a non-stimulant medication which works very differently, atomoxetine or Strattera.
Yes.
Okay, so now we tend to almost invariably start off with a stimulant medication for a number of reasons. The first is that it is by far the most effective in the most cases.
And the quickest.
That's the important thing. It starts almost immediately. Within a week, you've got a good idea of whether it's working or not. Whereas the atomoxetine, the Strattera, takes 6 weeks before you know whether it's working or not.
So is that the half-life?
Well, no, you've got to build up the dose, and it needs that amount of time to change the sort of neurochemistry.
All right,
so the way it's working in the brain, yes.
Okay.
Whereas the stimulants work on the prefrontal cortex, on dopamine, which is a kind of almost immediate response. And what it's doing, it's really making up for the sort of what we assume, but this is probably a great simplification of the reality. But the way we understand it is a sort of relative lack of dopamine, which drives your focus, your executive functioning. And another thing that's important in terms of executive functioning is the ability to inhibit oneself. Okay. And that's one of the tests they use. The Stroop test, where you've got to inhibit reflexly and impulsively doing what you think is right, and stop and think about it. So that is inhibition. Just give a breathe, just to be able to put on the brakes, take a breath, think, this is what would be appropriate, this is what I should be doing, instead of impulsively doing something. And the kind of common way that children exhibit this is just blurting out answers in this classroom if they know the answers. But adults will do the same, only they're not in the classroom, and where this often manifests is in their social relationships.
Yes.
So they'll blurt out things and say things and, embarrass themselves possibly, and then afterwards say, I shouldn't have said that,
So that's what I call foot-in-mouth disease.
Yes.
Do you find that the adults that you've seen are presenting with depression and anxiety when in fact it's either an underlying attention deficit disorder or a comorbidity?
Yes. Look, both of those are very common.
Okay.
So the coexistence of ADHD, and I often imagine myself in their position. If I had been trying, and a lot of these adults have actually done reasonably well just through sheer dint of hard work. Quite a few of my colleagues, and it seems to have been just anecdotally that it's been more of my female colleagues who have struggled through their medical training. They got through school, but they worked hard. Through their medical training, they had to work extra hard.
Sure.
And they still succeeded, and they've got to where they are. But at the cost of enormous effort. And so I imagine myself in their position. You're working as hard as you can, and you're just not achieving what you know you could achieve. So then you start looking at it, and if you realize, yes, it's because I've got attention deficit disorder, and you treat it, suddenly it becomes that much more easy to achieve to your potential. So all those years of underachieving takes its toll, and it leads to not usually a major depression, but a kind of dysphoria and unhappiness.
Dysphoria.
Yes.
There was
and an anxiety. Am I going to forget the next appointment? Am I going to lose it? Where am I going to find it? I'm always forgetting things. So it will increase anxiety levels, and those adult patients, if they respond to the treatment for attention deficit disorder, immediately there's an improvement in mood, decrease in anxiety, and they feel much better.
You talk about some of your colleagues. I have a client who we work online.
Yes.
She lives in another country, and she's an emergency specialist.
Mm-hmm.
And she's always, all the years, been treated for depression.
Yes.
With antidepressants.
Right.
And she went many years ago to live in another country.
Mm-hmm.
And she went for a script or to ask about what she was taking. Should she be taking something different for depression?
Yes.
And her GP said, why don't you go and talk to a psychiatrist? She's very good.
Mm.
And my client went to a psychiatrist who said, I don't believe that you have depression.
Mm.
I believe you've got ADHD.
Yes.
My client said, horror, not me.
Yes.
She said, I've got through school, I've
Yes.
got through university. And she was constantly...
She's specialised,
She's constantly specialising.
Yes.
And she's in the midst of doing a huge exam at the moment.
Right.
And I'm helping her with deep muscle relaxation.
Yes.
But I never once thought that she might have an attention deficit disorder. So the psychiatrist said to her, do you struggle to find things in your kitchen cupboard?
Yes, a form there that the WHO has put out, which is a nice screening form.
Okay, because she says she was asked and she was saying yes and yes and yes. So the psychiatrist prescribed, and it was probably the Vyvanse.
Yes.
And she started to really focus very well.
Yeah.
It's made a huge difference. And they needed to tweak the doses.
Yes. So as I said, it's trial and error. Which form of stimulant is most effective for that patient?
Yes.
And that requires, fine titrating and personalised medicine sort of approach.
Right.
Because each person responds differently to the different medications.
So it's tweaked my mind.
Yes.
To look in a different way and perhaps to ask what are the questions that you
Well, the sort of questions are, generally I just ask on their functioning and, are you forgetful?
Yes.
Do you lose things? Do you procrastinate? Do you struggle to complete tasks?
Sure.
Do you find you get distracted easily?
Yes.
Do you struggle to focus on your task and then switch focus when you need to?
Or when you, yes.
And
do you get bored after a certain time?
Do you find that, and these questions, which we can put down are, and the first one is how often do you have trouble wrapping up the final details of a project?
Okay, interesting.
Once the challenging parts have been done. Because that is when you're trying to do a master's, of course, that's a huge struggle.
Yes.
How often do you have difficulty getting things in order when you have to do a task that requires organization? And when you have a task that requires a thought, how often do you avoid or delay getting started? Procrastination.
Absolutely. Absolutely.
So I'll just go through the main screening ones then. How often do you fidget or squirm with your hands or your feet when you've got to sit still for a long time?
Right.
And how often do you feel overly active and compelled to do things as if you were driven by a motor? So the last two are looking for the hyperactivity
element.
It's designed by the WHO as a self-screening tool.
So it would help the person and the health professional.
And the health professional.
And the teacher.
Yes.
If need be.
This is designed for adults. This one is designed for adults. Yes.
And can I ask, the hyperactivity element?
Yes.
Is it sometimes in the fidgety, like you see people who are all over that couldn't sit like this for this long?
Exactly.
Or else, is there sometimes a mental hyperactivity where the mind's going but the body not so much?
Yes, as people get older, that's quite often happens.
Okay.
It's the mind that is overactive.
Keeps going.
But you still see adults who, what we call energizer bunnies, always on the go.
Yes.
They're never sitting still.
And Carl, is that more women than men, more men than women, or again similar?
That, on the whole, I've tended to see in clinical practices more in men than in women. Anecdotally, yes.
So would that sometimes mean that women get misdiagnosed because they don't present generally and anecdotally? There's been some research of late about women getting misdiagnosed because they present with perhaps depression and anxiety and not with the hyperactive symptoms.
Yes, that definitely does seem to happen in women. It happens in girls as well, in both pre-adolescent and adolescent girls, that they tend on the whole not to be so hyperactive,
right.
but more subdued.
So they might
and they quite often then do seem depressed, yes.
And is it, what they're talking about in the research is that late adolescent boys might get diagnosed in their late adolescence, while girls would be sort of 4 years later.
Yes.
Is that
yes.
the...
That is, or has been. Whether it'll change as we become more aware, it's another thing. But that certainly is the pattern that's prevalent at the moment, yes.
And did you find that when adults have come to you with their children or by themselves, that when you've diagnosed them with attention deficit or ADHD, that they might go off the antidepressant medication, or would you keep them on both, or what?
Okay, what I normally would do is keep them on the antidepressant medication.
Sure.
Do a trial, and I always say this is a trial of stimulant medication.
Okay.
Let's try it for 2 or 3 weeks.
Yes.
And then let's meet again and let's review how it's working. If that seems to make a very significant difference, further down the line, we will have a conversation then about the possibility of stopping the antidepressant. Because, the question then is, do you really still need the antidepressant?
You need it? Sure.
And we don't want to keep somebody on medication if it's not necessary.
And besides medication for adults, would you recommend physical exercise as a treatment adjunct to the medication, or as a trial before medication?
Look, physical exercise is always an excellent thing to do, and I always recommend physical exercise and activity, particularly if they've been underactive. But the one thing that is an adjunct to treatment really is some form of coaching. Coaching in terms of executive functioning, of organizational skills, time management.
And while I've been, as I said, finding the YouTube button on my television, I've been listening to a lot about nutrition and the mind.
Yes.
And I'm not sure what your experience has been with the idea of plant-based and not ultra-processed foods and hyperactivity or ADHD. What has been your experience, if at all?
Yes, look, I haven't had much experience in terms of
nutrition,
actually working with nutrition.
Okay.
But I do believe, and it's really something I've read up about more out of interest rather than related specifically to ADHD, I think probably it plays a greater role in depression and anxiety
than hyperactivity.
Than in hyperactivity.
Right.
Than in attention deficit disorder. Because what is becoming clearer and clearer, there's a huge association between bowel health, gastrointestinal health, the microbiome.
That's what I'm seeing too.
Yes. And mental health and general well-being.
Yes.
So in terms of general well-being, I think it's hugely important.
It's new in my world, but speaking to people in the know and scientists and microbiologists, they've known this for a long time.
Well, there's an awful lot about it that we don't know yet about it, and I think that's where the work is happening that is so exciting.
Very exciting.
Yes.
It's extremely exciting, and just having been off work this year for a while with ill health and digestive ill health, and watching the YouTube videos, I've been putting into practice eating like they tell me to.
Yes, healthy eating.
Mainly plant-based.
Plant-based,
and avoiding sugars.
Yes.
And it feels amazing, really. I don't believe in being rigid and dogmatic. I believe in an 80-20 principle. And just that you don't feel too deprived.
Yes, I think one's got to be practical and realistic.
But I wondered about a link with attention deficit.
Yes, I think the one link that might be able to see more clearly is the link with sugar.
Yes.
And certainly with children who are prone to ADHD, their sugar rushes certainly do seem to manifest. And I think really sugar is, in the levels that we get it, sugar, salt, excess salt in food, fast foods, excess sugar.
There's much more attention being paid in general to health, general health, like you say, and mental health and mental well-being.
Yes.
I've been working with groups of entrepreneurs, and I'm not sure again if it's anecdotal, but a lot of them are telling the stories about their childhood not achieving well at school, not being diagnosed as ADHD, but coming into adulthood often as successful entrepreneurs.
Yes.
No medicine, no diagnosis, but often cancer still, forgetful, and probably would function way better with better health of their businesses if they were diagnosed and treated.
Certainly, I think that is true. A lot of, the Richard Bransons, probably Elon Musk's, the people, a lot of people, I think they said Einstein had ADHD. I think the people who come up with out-of-the-box thinking, because a lot of that is spontaneous and impulsive.
On the good side.
Absolutely, it's the positive.
Sure.
And the one way of looking at it, right at the beginning I said we call it a disorder, but perhaps we need to look at it a bit differently, also to help counteract that stigma that it has.
The negativity and the stigma, sure.
And one of the sort of stories that I tell is around the question of, if ADHD was a disorder, why is it so prevalent still in the population? And one of the ways of looking at it is, in very recent history of the human race, we were not living in an urban, organized, structured society like we are. Highly technological, highly disciplined, highly controlled in many ways, got to work to the clock. Pressure, and constrained in so many ways.
In the box. So in very recent human history, particularly in evolutionary history, we would be sitting in a cave here, and I might be telling a story to the rest of the clan sitting there. Sure.
But at any moment, saber-toothed cat might come to the mouth of the cave. So the one person who wasn't listening and paying close attention to my story would be kind of looking around, not paying attention, and suddenly they'd notice the cat and they would scream out and alert the rest of us, and we could all jump up and defend ourselves against that saber-toothed cat. So that it doesn't have an advantage for the individual, but it has an advantage for the group.
For the system, the clan.
The system, the clan. A little later, they decide to go out gathering. The woman in particular, let's be a bit sexist. The woman, and it seems this is how those societies worked, would be looking for fruit and bulbs and roots and leaves and edible plant matter. And one of the young women or girls would see something that looked nice, grab it and eat it, and they'd all say, "Oh, but we don't know what that is." And she'd eat it, say, "Tastes delicious." And they'd watch her. She didn't fall ill.
Then they could eat.
it. So she discovered a new source of nutrition. The men were out hunting for animals, and the focused men without ADHD were carefully tracking the spoor. But the one guy he couldn't pay attention to this for too long, so he was off all over the place and up onto the top of the ridge. And he said, "Hey guys, there's a whole herd over that side," which they would have taken about a few hours to get to. He's made a shortcut. So there's been a benefit for the group as a whole.
I like the coming round.
Yes.
There's a downside.
Yes.
And yes, there's an upside.
Absolutely.
And there were parents who recently wrote a book, and for the life of me, I can't remember their name, but they wrote about ADHD is awesome.
Yes.
Thriving with ADHD.
Okay, good.
And their child, as you said, their child was diagnosed with ADHD, and then I think the father realized he had it.
Yes.
And I haven't read the book, but they navigated the journey and have picked up what I would call the caveman scenarios, or the positivity in this story.
Yes. So, yes, entrepreneurs are the ones who tend to have it because they're not sticking to a 9-to-5 job, filling in ledgers and so on. They're thinking, and those who are successful are those who are able to build up a support structure around
100%.
them.
That's what we found also. What you're saying, they delegate to members of their trusted team.
Yes.
And that's what they can do. They do what they do well, and then what they don't do so well, they delegate.
It's the team, the personal assistant, the secretary, the person who holds the whole lot together.
The people holding their hand and doing the detailed stuff. Detailed,
down to earth, nitty gritty.
So, in a nutshell, the recognition of attention deficit or ADHD would be according to your list, and we're going to post that on this video.
Yes.
And then treatment for would include perhaps medication when appropriate of different sorts, and perhaps finely tuned.
Yes.
Plus coaching.
Yes.
Executive coaching for adults.
Yes.
Plus exercise, physical activity that can release the hormones and burn up some of the adrenaline, and other...
Also nutritional health, just in terms of general well-being.
Yes. And probably in terms of nutrition, perhaps avoidance of ultra-processed food would be a good start.
Absolutely.
Thank you for so much valuable information for me as a healthcare provider, for my people, so that my awareness of people coming to me with attention deficits hopefully will be smarter and sharper, and I'll have more questions to ask.
Hopefully, I hope that this has been helpful. Yes.
Thank you. Thanks very much, Carl.